Lisa Vetten, a UJ Humanities Research and Project Consultant, joins us now. Lisa, good evening to you and welcome. Hopefully we'll have time to talk about the developments in Soweto, which in some way talk to some of the services that NPOs in our communities across the country provide. And just to let you know, we might break out of our interview at some point as soon as we hear that the Premier of Gauteng, Panyaza Lesufi, is ready to address the media about that. But let's come back to this budget for NPOs, indeed being slashed by about 417 million rand. What can you share with us?
Well, firstly, it is disingenuous to say that the NPOs have not lost their funding. There was a meeting on the 5th of April called by the MEC for Social Development to explain that the budget had been reprioritized. So this 417 million has been taken away from social care services, and those are the services to people with disabilities, older persons, children, people in conflict with the law going through diversion programs, and that this has been taken away and it's been given to projects located in development and research. So effectively, through this prioritization, what the Department of Social Development is telling us is that waste management recycling, which is a new project they hope to be doing in development and research, sewing school uniforms, organizing cooperatives and packing dignity packs is more of a priority than looking after children and ensuring that you have child protection organizations that are functional and that you have residential facilities able to look after people with disabilities and prevent yet another life to Esidimeni.
Some people would argue that you shouldn't even have to make that choice between some of those projects you say, you know, where that money might be redirected to and the core work that NPOs do. Talk to us about the impact of this diversion to stakeholders, which includes subsidies for child protection organizations and social workers. And incidentally, Lisa, the numbers we are seeing are dramatic. A social worker who earned 14,500 rand a month would now draw just over 5,500 rand only. There's a major impact to services there.
There's a very major impact. It's, you know, firstly, it's a violation of people's labor rights. I mean, what is particularly alarming is that in this current economic climate, the department has slashed subsidies to below national minimum wage. So childcare workers who were earning over 6,000 rand are now earning 2,900 rand, if they've even been refunded at all. While care workers who were earning 2,900 are now on 1,200 rand. Now, nobody can work for that. You know, people went to bed on March 31st thinking they had a job and they discovered on 1st of April, actually they don't anymore. So there are a number of organizations that are quite seriously looking at having to close at the end of the month, like Central Gauteng Mental Health, the Gauteng Association for People with Disabilities, Soweto Centre for Independent Living. Yeah. So there's a range of organizations. We're trying to assess it now.
There's a whole of about 417 million rand now that doesn't exist anymore for social workers to do that work. Lisa, you would have heard the Premier there talk about partnerships that are needed in communities. NPOs stand in that gap. They are literally that partnership that the Premier is talking about. What did you make of what he said?
Look, I mean, without, I think, in any way wanting to detract from these terrible murders that have happened in Soweto, the reality is that the vast majority of children, when they're murdered, are murdered by someone they know, a family member, and more often than not, children are more likely to be abused than necessarily to be murdered. And this is why child protection is so important. Child protection is there to be able to identify when children are being abused, to be able to remove them, to put them into places of safety or to put them into foster care. So when those cases get pushed to one side or seen as being less important, that's very, very concerning, because that is where the bulk of abuse is happening and it's where the bulk of child protection needs to happen. And if you're cutting those services, then that's where we are likely to see tragedies, children left in the care of people who they should not paying sufficient attention to care and neglect, which leads to children's deaths. That's very concerning. I mean, these cuts are also concerning in that they also affect children with disabilities. And children with disabilities are very often targets because they may not necessarily have the speech or other capacities to be able to tell people what's happening to them. And so places of safety for them to go after school are really important. And having to see those closed is extremely concerning. What's no less concerning, I think we should also think about as a form of violence, is children not having enough to eat. And so when we see organizations' ability to feed children, their food parcels, their after-school programs, their school feeding schemes also being either terminated altogether or considerably reduced. The one organization gave us the figure of now having 6.70 rand to be able to feed a child on a daily basis. then you're doing another kind of violence that relates to malnutrition. So I think we must look at that broader span of violence and think about what's going to happen if we allow our child protection services to collapse. And I mean, I think we must remember that many services in this province are provided by NPOs in partnership with the department.
And it's a story we'll be covering about the nutrition, provision for schoolgoers in KwaZulu-Natal. But you talk about those school programs and how important they are. Sometimes it's the only meal that a child will have in a day. When we go back to the budget, again, what problems are likely to be worsened by this state of affairs, especially given that despite the budget cuts, NPOs still have to meet their targets?
Sorry about that, Iman. I think this is the point, is that organizations have to think very carefully whether they can realistically offer and ethically, realistically offer a quality service. We all know what happened in the case of Life Esidimeni, where NGOs took care of people whom they did not have sufficient money to do so. And we saw the consequences of that. I mean, there were NGOs who didn't have enough money to buy food for the people in their care. And we do not, under any circumstances, as NGOs, I think, want to see something like Life Esidimeni happen in the province again. And this becomes very concerning in relation to the number of subsidies and services that have been outright terminated for people with disabilities. We've seen that at least the department itself in their budget vote has cut and reduced residential facilities to 220 people with disabilities. So I'll give you an example. I was talking about Soweto Independent Living Centre. That was able to provide, it's one example, but they were providing care for 30 people who are quadriplegic. Their service has been terminated. Who is going to look after those people now? Where are they going to go? And I think the other concern then is what happens is that this pushes care back onto families, and very often that will be a woman who will now have to give her own unpaid care work, perhaps leave her job, alter her work in order to be able to provide that kind of care to her family member. So this has ripple effects that go beyond NGOs.
Massive impact. And Lisa, thank you so much for sharing with us the breadth and scope of that impact. Lisa Vetten is with UJ's Humanities Department. We appreciate her time tonight.